Hi, Dr. Raval. Welcome to Doc Dynasty. And today we're going to talk about a popular topic. Very happy to be featured in Becker's Leadership, one of the largest online medical magazines. And the question that was posed to many of us physicians was, is medical school missing the mark? So we've talked about this quite a bit. This article covered all kinds of specialists, ones that worked in networks, two medical directors, internal medicine, ophthalmology, gastroenterology, family medicine, and of course podiatry. And so all of us kind of converged on a few topics, one of which is AI literacy. The thought is, in the future, all of us will have phones as physicians and residents and fellows where we can punch in what all the symptoms are that we're going over with a patient, and that will produce a differential diagnosis. So there should be less memorizing and more AI literacy. And the rest of us agreed, number one, that as we've moved from 40 years ago to 50 years ago from a physician-based care model where physicians collaborated to come up with a diagnosis and treatment, we are now in collaboration with our patients. It's a patient-centered care where we talk to the patient, we see what their symptoms are, see how they've taken care of themselves, and offer our help. So that change in model is number one, very important, but it's also very important in the care of that patient. Third item is the business part of medicine, which we've talked about on this channel. The fundamentals of business, several have mentioned that, but I'm going to go into more details now. I feel in the last semester, after residents are all matched, or students are all matched to their residencies, there are 5 things that are the basics that should be taught. Number one, how to start a medical business. And that's everything from hiring a staff to learning software, how to differentiate between software that you want to work with, supplies, furniture, etc. I've written a book on this, available on Amazon, Physician Practice Blueprint for students for this reason. Your pros and cons of opening your own practice versus working for a private equity versus working for a multi-specialty group. Very important to look at what your options are. Whether you be salary-based or insurance-based as far as your paycheck. Number 3, basic accounting. We all agree with this. Basics of business structure and tax liability. You need to look at how you're going to practice and what effect this has on your taxes and where you want to go. And lastly, how to evaluate an employment contract. I cannot tell you, in the last couple of years, I'm looking at residents bringing in contracts that they're being offered where they give away their name and how far away they can practice because they're working for someone else. You absolutely need this looked at by an attorney. You're giving up your future. You're giving up all the things that you can do. Consult, write books, open your own practice. So much available on social media as well. So you really have to be know about employment contracts, what kind of things there are, and how to evaluate them. I hope this is helpful.